प्रुडंट मिडियाच्या गजाली कार्यावळींत तुमकां सगळ्यांक काळजांसान येवकार. आयज काळजांचो म्हणटना आनी एक स्पेशलिटी ताचें एक वैशिश्ट्य अशें आसा की काळजाच्या दुयेंसा विशीं ती कशी टाळप, ती कशा रितीन आमी तांचेर जैत जोडयता हाचेर आमकां विशेश म्हायती दिवपा खातीर आमच्या स्टुडियोंत आमचे वर खाशेले अतिथी आसात. डॉक्टर रवी कसलीवाल, जे जावन आसात चेअरमन डिव्हिजन ऑफ क्लिनिकल अँड प्रिव्हेंटिव्ह कार्डिओलॉजी, मेदांता हार्ट इन्स्टिट्यूट, नवी दिल्ली. आणि एक अतिशय जागतीक कीर्तीचे व्यक्तिमत्व, कोइन्सिडेंटली ते गोंयांत आयिल्ले, त्या निमतान आमची ही कार्यावळ आमी तुमच्या मुखार सादर करतात. डॉक्टर नमस्कार.
नमस्कार.
वेलकम. इनफैक्ट ऑलवेज एवरीथिंग वी से दिल से, एनीथिंग जो भी करते हैं दिल से करते हैं. So heart becomes the most important organ. Though brain has lot of role to play, everybody when any say मैं दिल से प्यार करता हूँ, काम दिल से करो, दिल लगा के करो, दिल रुक गया, दिल दे चुके सनम. So everything is related to the heart only.
Yes.
So just to start, like I would like to know your journey from intervention cardiology to the preventive cardiology, because you have traveled a enough number of miles and covered enough kilometers, I should say, in these steps towards protection of the heart in the general.
सबसे पहले आप यू हैव सेड अ वेरी गुड थिंग, दिल से, हर चीज़ दिल से होती है.
करेक्ट.
हार्टी मील ना लें आप, तब तक सब ठीक रहता है.
करेक्ट.
तो मेरी जर्नी चालू हुई ऑल इंडिया इंस्टीट्यूट ऑफ मेडिकल साइंसेज से, जहाँ से मैंने डीएम कार्डियोलॉजी किया. और वहाँ से उस समय वेल्वुलर हार्ट डिजीज़ ही ज़्यादा होती थी. और जैसे जैसे समय बीतता गया हमें लगा कि वेल्वुलर हार्ट डिजीज़ तो इंडिया में है ही है.
करेक्ट.
लेकिन ये हार्ट की जो 3 आर्टरीज़ हैं, ये बहुत गजब ढा रही हैं, इन द सेंस कि कॉरोनरी आर्टरी डिजीज़ एकदम से बहुत इम्पॉर्टेंट हो गई. और वो भी आप देखिए बिल्कुल करेक्ट था कि लाइफस्टाइल लोगों का चेंज हो रहा था. अब हम स्मोकिंग हमारी बहुत बढ़ रही थी, हाई ब्लड प्रेशर हमारा बढ़ रहा था, कोलेस्ट्रॉल लेवल्स बढ़ गए थे. और सबसे इम्पॉर्टेंट बात जो हुई वो ये था कि जीवन में तनाव बहुत था, वो बढ़ रहा था. और आप देखिए पिछले 3 दशक में किस तरह तनाव ने, फिजिकल इनएक्टिविटी ने, ग्रोइंग ओबेसिटी ने दिल की बीमारियों को और स्ट्रोक को इतना बढ़ा के नंबर 1 पॉइंट पे लिया है कि कल वर्ल्ड हार्ट डे पे हर जगह यही बात हो रही थी कि भाई हर चीज़ दिल से ही क्यों हो रही है कनेक्टेड. तो ये बात है.
Yeah, in fact, Doctor, you have said it very nicely, and I am very happy that the way you have projected ki our lifestyle is changing, and that change of lifestyle has invited these problems, which were not so frequent the way it was earlier. Maybe it is rightly said that my body is designed to work and mind is designed to rest. Unfortunately, हम लोग अलग करते हैं because आजकल everything what we are doing, we are using remote, we want to go by the car, vehicle, whichever convenience, from AC, everywhere. Lack of exercise, our diet, all these things are playing a role. And as you have rightly said that our lifestyle, your stress, that has given. So I would like to know at this forum, like how you correlate stress and all these factors which are gradually coming up. And other things related to heart. So the floor is yours.
No, but it's a very good thing you've asked. It's good we are starting from stress. We know, everybody knows the conventional risk factors, and we will come to that.
Correct.
But stress has become so, I always say that stress is of 2 kinds.
Correct.
Good stress is also required. I'm sitting in the studio, I'm sitting with you, I cannot be sitting just totally relaxed. My body's adrenaline levels are a little higher, my heart rate is slightly higher, my blood pressure. That is good stress. I'm, whatever you ask, whatever we talk, I'm able to, because my mind is working at full pitch. But there is a other kind of stress, which is the bed stress. This can be acute, like the loss of bereavements or loss of salary or job, and it can be chronic. That means every day there is pressure of gas not coming or electricity going away or
your targets
not being met. These are the stressors, as we call them, which cause internal derangement of the body, truly, and lead to thickening of the arteries of the heart, as of the brain, as of everywhere else. But in the heart it becomes more important because thickening, if it takes place, coupled with bad food and lack of exercise, it results in heart attacks. And as we know, 30% of heart attack patients, 25% of heart attack patients never get a chance to get up from the floor and say, please save me. Something is going wrong. So stress is both good and bad. It's a very good thing you have asked this at the very beginning. It can be controlled, and there is nobody in the world who can upright stand up and say,
I don't have any stress.
I have no stress. But it is how you take it.
Correct.
If you always internalize your stress, you're in trouble. But if you have a mentor, you have a senior, you have a wife, you have whom you can say, look, my guys are troubling me. I want to talk to you. Is there something wrong with me? Can I become better? Those stresses will disappear. Well, or at least lessen.
Yeah, lesser.
I don't.
So we can share our
worries.
Sharing.
One thing that I have realized over a period of time is that people who rationally look at their problems and those who time manage themselves well are the ones who have less stress. A person who comes late to work will always be late at everything.
Correct.
His patients are waiting, he's going to get flagged there, or his boss is waiting, he will get a flag there. And therefore, naturally, there is a revulsion that, look, I'm doing the work and I'm getting. So, time management is extremely important in this fast moving world. And also, it is important to rationalize and to talk and to discuss. And these are the things I feel. Like, I give you an example, even our 12-year-old boy, our child who goes to work, to school, I mean, he's also under stress.
Absolutely.
Because we have given him stress at his back.
Yeah.
With a 10-kilo pack. And now we are saying, why did you not get 90%
Correct.
marks, 95% all the time?
Yeah.
So, we as seniors are also responsible for many of the stress of the younger people. Our expectations from them have grown. Also, there is a growing need for financial needs are growing, wants are increasing, because we look at the TV, we look at things and we see how people are flashing there.
Okay.
So, somewhere a person has to draw a line and say, look, I'm very good at it, I've developed these skill sets, I will not be bothered, and this is how I will go, this is my immediate surroundings. So, you have to come to terms with
yourself.
And your family will be with you.
Absolutely.
I can tell you.
Yeah, Doctor, I think you have really touched the main chord of this issue, because, sir, I would like to know one more thing. Like this year, we are celebrating World Health Heart
Day. Yes.
And what is the slogan and how it is related? So that because now you are in Goa to pass on the message. In fact, I must appreciate that you have taken all the pains, efforts, despite of your busy schedule. You are in Goa and you want this message to go to the public. What is the theme of this year?
No, the theme of this year is that external pollution, atmospheric pollution, it is also giving rise to a lot of heart disease, lot of increase in high blood pressure. And therefore, they want government's involvement at this stage. That look, if the vehicles are polluting or if the industry is polluting, well, the common man cannot do anything.
Absolutely.
So, the common man has to look at his risk factors, diabetes, blood pressure, cigarette smoking, cholesterol, physical inactivity very well, and combine these, the social, they should look at our problems externally. So, I think the theme is very good. It matches heart disease as occurs to an individual and how the atmosphere and plays a major role in this. So
in fact, I feel that this is like a synchronized methodology, because see, as you have rightly said, there are our internal factors. Like see, I can say, okay, I'll take care of my stress. I'm not target oriented. I'm little relaxed. But if the environmental factors are really affecting me, which is not under my control as a common man, so we should have a streamline our both, means as a government setup also and from the individual level also, so that we can get a better performance at our heart level.
Yes.
Correct? Yes. So, Doctor, I would like to know, say, what you have observed in last few years, like because now suddenly, means everybody is saying, okay, lifestyle disorder, it has become almost a slogan for the entire world. So, you have rightly said that our own targets, okay, our own, we expect a lot of things at every point. Like, see, when I'm working, I want to expect my promotions faster, I want my higher salary, I want a good house, I want ACs. I want my son to study in a good school. I want him to get a good marks. So everywhere I want the best.
Yes.
So I'm not ready to for compromise. For that I'm struggling day and night like this thing. In fact, it reminds me of a beautiful book. I think if I'm not mistaken, the book title is Help Me to Heal. And then the author says, he's a pediatric surgeon, and he has nicely said, if given chance to reborn, I would like to become a hunter. and stay in the jungle, where I'll just go for hunting as and when required and teach my children how to hunt
Yes.
and just manage yourself.
Yes.
Environmental should not take it other way around.
Yes,
What I
yes.
mean to say means means after earning so much, he feel that okay, this is enough.
Too much.
Too much.
I want to go back to the basics. Yes.
Go back to the basics.
Yes.
I want you to correlate this and go ahead. How we have to each one as an individual take care of his or her own heart,
Yes.
and give a better performance at personal level as well as community level and social level and at country level at large.
Yes, very, very, very good question. So I think the first thing that everybody has to do, they have to realize that as Indians, we have the highest chance of getting heart attacks.
Yeah.
60% of the world's heart attacks, STEMIs as they're called, occur in our part of the world, South Asia, particularly India. So first is the earthly thing, the scientific thing, let us look inside. Am I a diabetic? Do I have high blood pressure? Do I abuse nicotine? Do I smoke? What are my cholesterol levels? How physically active I am? What is my body mass index? What are my stress levels? So, if you see all these factors, nothing is non-modifiable. All of them can be modified. Am I taking enough vegetables? And I'm not abusing alcohol. These are the 9 risk factors as told in the Inter-Heart study.
Correct.
Everything is modifiable. So first we start with that level. So men over 25, women over 30 should have their first examination. Meaning that how will you know? Indians, all of us are waiting for symptoms to occur. Sir, मेरे को chest pain ही नहीं था, मैं क्यों आता आपके पास? हम कह रहे हैं you have to take 10 steps before that. We don't want you to get a chest pain. We don't want you to get bypass or angioplasty. We want to save you that look, your father had a heart attack, your uncles had it, you are at high risk. Can I detect it before a calamity occurs?
No.
But for that, you will have to come to me
Absolutely.
and at least get the basic tests done.
Absolutely.
Which you don't have to come to Madanda. You know, Goa's got such good facilities. Anybody can take your blood pressure, take your waist circumference, take your height, and do a lipid profile. We are the diabetes capital of the world.
Correct.
So why should we not get our blood pressure, the sugar checked? We are so casual about our blood pressure. 150 by 90 को सर कुछ भी नहीं है सर 150 90 है कभी कभी हेडेक हो जाता है पर एक दिन स्ट्रोक होगा ना उससे. So by this medium and by people like you who are so into the system, that you can create a wave that please do not wait for symptoms. Anyway 30% will not have symptoms.
Correct.
Anyway diabetics will have very atypical symptoms which will be ignored. So if you are a high risk individual, come before that. Let the doctors have a look at you. They can scan your carotid arteries, they can do pulse wave velocity, simple things, and say, look, you are at a higher risk. So we are not coming in the way of your ambition. You work 12 hours a day.
Correct.
But boy, get up early, go for a walk, do yoga, do some pranayam, healthy food. That's the only way of, but till you detect it, how you can't say this to everybody.
Correct.
Everybody will not follow. But those who are at high risk, who are the high risk people? Diabetes people are high risk. High blood pressure patients are high risk. And those who have both these brothers, they are bad brothers. They are at the highest risk. And smoking is one of the scourges of our human existence. You know, nothing can be worse than that.
Yeah.
You are destroying yourself. You are destroying your wife and children who are passively smoking. And if you have small children and you have put ash on the carpets, if they take it, it is called tertiary smoking, even they are at risk. So it is plain and simple healthy living. But you have to detect it also.
Correct.